You're sitting in the doctor's office, doubled over, and she looks at you and says, "Periods are supposed to hurt." You nod, you leave. You go home and curl up on the bathroom floor because standing makes you dizzy. And somewhere in your mind, you're doing that calculation every woman knows. Is this pain normal, or am I being dramatic? Here's what nobody tells you. Your body has been screaming for years, and everyone around you trained you to whisper. The pain that makes you vomit isn't normal. The exhaustion that feels like you're dragging yourself through mud isn't just being tired. And the fact that it took you this long to question it? That's not your fault. That's the system working exactly as designed. Let's talk about what's actually happening inside your body and why it matters right now. Doctors love the pain scale. 1 to 10, how bad is it? But here's the problem. Nobody has a reference point for what 7 means when it comes to periods. You've been told since you were 13 that cramps are part of being a woman. So when you say 7, you mean 7 compared to what you think everyone else experiences. You have no idea that other women aren't spending day 2 of their cycle in the fetal position. Real normal period pain responds to over-the-counter ibuprofen. It's uncomfortable. It might make you want to stay in bed an extra hour, but it doesn't make you cancel plans. It doesn't make you call out of work. And it definitely doesn't make you throw up from the intensity. Normalized suffering looks different. It's pain that radiates down your legs. It's cramping so severe you can't stand up straight. It's the kind of pain that makes you sweat, that makes you nauseous, that has you bargaining with your body to just let you get through the next hour. That's not normal. That's your body telling you something is wrong. And then there are the symptoms hiding in plain sight. Painful bowel movements during your period that you've convinced yourself are just part of the digestive weirdness that comes with hormones. Pain during sex that you've learned to grit your teeth through because you don't want to be difficult. Chronic fatigue that everyone dismisses as you just being tired, when really you're operating at half capacity most of the month. These are textbook endometriosis symptoms. But it takes an average of 7 to 10 years for someone to get diagnosed. 7 to 10 years of being told is normal. Why? Because the symptoms overlap with what we've been conditioned to accept as bad periods. Because doctors dismiss young women as exaggerating. And because there's no definitive test for endometriosis except surgery, which means most doctors won't investigate until you've tried everything else first. Here's how the gaslighting loop works. You mention the pain. Your doctor says it's normal. You stop mentioning it because you don't want to seem like you're complaining. So the next appointment, when they ask how you're doing, you say fine. And because you said fine, they never dig deeper. They never order the ultrasound. They never refer you to a specialist. And the endometriosis keeps growing. You start to internalize it. Maybe you do have a low pain tolerance. Maybe everyone else is just tougher than you. Maybe this is what being a woman feels like, and you need to suck it up. But your gut keeps whispering that something's off. You're right. Your instinct has been right this whole time. This isn't about pain tolerance. This is about tissue growing where it shouldn't, bleeding where it can't escape, and your body trying to tell you that every single month. Let me explain what endometriosis actually is, because most doctors won't take the time. Your uterus is lined with endometrial tissue, normal. That tissue stays inside your uterus. Also normal. But with endometriosis, that same tissue starts growing outside the uterus, on your ovaries, on your bowel, on your bladder, sometimes even on your diaphragm or lungs. Now here's the part that makes it so brutal. During your period, all endometrial tissue responds to your hormones and bleeds. The tissue inside your uterus bleeds and exits through your vagina, but the tissue growing on your ovaries or bowel, it bleeds too, except it has nowhere to go. So it just sits there, causing inflammation, irritating everything around it, building up month after month, eventually forming scar tissue that your doctor will never mention until it's already destroyed half your quality of life. That scar tissue is called adhesions. And adhesions don't just sit quietly, they glue your organs together. Your ovary gets stuck to your bowel. Your uterus gets tethered to your abdominal wall. Every time you move, every time those organs try to function normally, they're pulling against tissue that's literally glued in place. That's the pain you feel that nobody can see. Then there are chocolate cysts. Yes, that's the actual medical term. These are cysts on your ovaries filled with old endometrial blood. They're called chocolate cysts because of the dark brown color. Charming, right? These cysts can grow to the size of an orange. They can rupture. And when they do, the pain is so severe that women end up in the emergency room thinking their appendix burst. It gets worse. In severe cases, endometriosis can cause bowel obstruction. The tissue grows so thick on the intestines that it narrows the passageway. You get constipation that no amount of fiber fixes. Bloating that makes you look 6 months pregnant. And doctors tell you it's IBS and send you home with dietary advice. Now here's the part that will make you furious. Standard ultrasounds miss most of this. Unless you have a large chocolate cyst or severe adhesions, endometriosis doesn't show up on imaging. It's invisible. So you go in for an ultrasound, it comes back normal, and your doctor says, see, there's nothing wrong. But there is. The technology just can't see it. The only definitive way to diagnose endometriosis is laparoscope surgery. They put a tiny camera inside your abdomen and look for the tissue. But most doctors won't do that until you've tried birth control, pain medication, physical therapy, dietary changes, and whatever else they can think of first. So you spend years in this limbo, knowing something's wrong, having no proof, being told you're fine when you're absolutely not fine. And nobody warns you about the fertility impact until it's too late. Endometriosis causes scar tissue that can block your fallopian tubes. It can damage your ovarian reserve. By the time you're ready to have kids, you find out that the years of dismissed pain actually cost you your fertility. The tissue that everyone said was no big deal was quietly destroying your reproductive system the whole time. Knowing what's happening inside your body doesn't erase the years you lost to dismissal. But it does give you the language to fight back. There's a phrase that changes everything in a doctor's appointment. When they brush off your symptoms, when they tell you to just try another round of birth control, you say this: I need you to document in my chart that you're refusing further investigation. Watch how fast the conversation shifts. Nobody wants that liability in writing. But you need to give them something to work with. Start tracking your symptoms the right way. Not just back cramps today in your phone notes. A real pain diary with specific details. Where exactly does it hurt? Left side, right side, lower back, radiating down your thigh? What time of your cycle? What makes it worse? Movement, eating, bowel movements, sex? Rate the pain, but also describe what it stops you from doing. Can't stand up, can't work, can't leave the house. That's the language doctors actually listen to. And here's the hard truth. Your general OBGYN might not be enough. You need an endometriosis specialist. Someone who does excision surgery, not just ablation. Ablation burns off the surface of the endometriosis tissue. Excision cuts it out at the root. Excision has way better long-term outcomes. But not every doctor is trained in it, and most won't tell you there's a difference. Treatment options go beyond just take birth control and see what happens. Birth control can suppress symptoms by stopping ovulation, which means less hormonal fluctuation and less bleeding. But it doesn't remove the tissue that's already there. It's management, not a cure. For some women, it's enough. For others, it just delays the inevitable. Excision surgery can remove the endometriosis tissue and adhesions. Pelvic floor physical therapy can help with the muscle tension and pain that develops from years of your body guarding against the pain. Pain management, real pain management, not just ibuprofen, can improve your quality of life while you figure out the rest. The biggest shift you can make is in how you talk about this. Stop asking, is this normal? Start saying, this is affecting my quality of life and I need answers. You're not asking permission to be taken seriously. You're stating a fact. Your pain is real. It's measurable by how it limits your life. And you deserve investigation, not dismissal. Your instinct has been right this whole time. You're not dramatic, you're not weak, you're not overreacting. You've been living with a chronic condition that the medical system is designed to overlook. But now you know what to look for, how to advocate, and what to demand. Pain that stops you from living your life is never normal, no matter how many people told you it was. You deserved answers years ago. If this sounds like your story, drop a comment. Share this with someone who needs to hear it. Your body's been trying to tell you something. It's time we all started listening.